So the Delta variant has sort of achieved the trifecta of transmissibility, severity, and immune escape. We know that it appears to be about twice as transmissible as the original Wuhan strain, so it spreads much more easily from person to person, which is why we've seen very rapid outbreaks and why it's able to outcompete other strains and now is now becoming the dominant strain in some countries. We also know that it's about twice as likely to result in hospitalization relative to other variants, so it does make some people sicker. And finally, while the vaccines do still work very well against the Delta variant, overall there is some level of immune escape, meaning that the vaccine effectiveness is slightly lower than it is for other variants. So those three things together have made this a really difficult challenge, both in countries like the UK and the US with high levels of vaccination, where we're still seeing a rise in cases with the Delta variant, but also is a real threat in the global south, where we may see a repeat of the sort of tragic circumstances that India faced in recent months.
Yeah, and India is now reporting a Delta plus. What are its variations?
So the so-called Delta plus is the same as the Delta variant, but it's picked up one additional mutation, one of the mutations that's part of the variant originally described in South Africa, which may, again, we don't really know yet, but there's some concern that that could further increase the severity and possibly affect the immune response to it. So again, it may be even a little bit more challenging a foe to deal with, and it's really important that we do everything we can to prevent the spread of these new variants.
Yeah. We are also hearing that it is more contagious among children. Is that what you're hearing?
It's not clear that it's more contagious among children relative to adults. I think it's more contagious for everybody. What we're probably seeing is that where we do have some data in places like the UK is that it's spreading most quickly in those who are not vaccinated. Those are young adults and those are children. We know that children are often not affected by getting very sick, but they can get infected and they can transmit infection. So we're seeing, for example, now in the UK, is the number of school absences due to COVID has tripled just over the last couple of weeks. We are seeing more kids getting infected, and that's that's one of the reasons that I think that the calls for vaccinations all the way down to children as young as 12 years and probably younger once we have the data to support safety are really important.
Yeah. New Zealand, of course, is going forward and looking at vaccinating 12 to 15-year-olds with the Pfizer vaccine. Children had been sort of going to be the last cab off the rank in terms of getting vaccinations, because in many parts of the world that is lagging even for adults. But is that something that perhaps is going to have to be brought forward?
Yeah, I think particularly with these more transmissible variants, it raises what we call the herd immunity threshold, the percent of the population we need to cover and give protection in order to really interrupt transmission and break the back of this pandemic. So we're now seeing that even though 90% of adults in the UK have antibody protection from vaccines or previous illness, we're still seeing exponential growth of the Delta variant. And so we need to understand that children are, of course, part of the population and could be reservoirs or further transmission. And so from the standpoint of population control, vaccinating children is really important. We also have to remember that even though kids rarely get severe COVID disease, they are still affected by so-called long COVID symptoms, sometimes up to 10% of children. So this is not a risk-free proposition for kids, and they also deserve vaccination where possible.
Yeah. Talking of vaccinations, there have been reports that China's Sinovac vaccine, which of course was widely distributed as the US and the UK were holding on to the vaccines that they had. But many of those countries which used it are now experiencing what seems to be a troubling resurgence. What do you put that down to?
Well, the Sinovac vaccine was well studied and demonstrated efficacy that was a little bit lower than some of the other vaccines, but was still well above the 50% threshold and was approved by the World Health Organization. So it does demonstrate good effectiveness. Some of the places like Chile, where we've seen breakthrough, probably result from the fact that vaccination rates just weren't high enough yet to necessarily interrupt transmission. I think it's a cautionary tale for all of us. The place I am concerned are some of the reports we're seeing from places like Indonesia Indonesia, where high numbers of health workers who had received the Sinovac vaccine are now being infected with COVID. There seem to be anecdotally a higher number of breakthrough infections in people who have been vaccinated with Sinovac. We don't have data to support that, and we don't yet know what the effect of the Delta variant is on this particular vaccine. What I would say is even if the effectiveness is a little bit lower in preventing disease, the vaccine is probably still very protective against severe disease, hospitalization, and death. So I would encourage everybody out there, if you have access to a vaccine, whichever one it is, to get it. And it's very important to get the 2-dose set because 1 dose is just not enough against Delta.
And that is such a great point because there's this whole discussion around mixing up the vaccines. Angela Merkel has, I think she got an AstraZeneca first. She's now going to get her second vaccine as a Moderna. In Germany, they're seeing that it's better to mix up the vaccines, whereas in Australia, they are saying stick to the one that you started with. Who do we listen to?
You know, the evidence is still emerging on this. Of course, most of the clinical trials that were done to lead to authorizations were done with each individual vaccine in its series of 1 or 2 doses, depending on the vaccine. There are some ongoing trials now that are looking at the theory that mixing different types of vaccines may give you more of an immune boost. And I think the jury is still out on that. Here in the UK, where there's a lot of further planning towards the potential for booster vaccines as early as this autumn, are looking at the possibilities of mixing up those vaccines. Again, the solid data that we have suggests that all of these vaccines, Moderna, Pfizer, Oxford AstraZeneca, Sinovac, etc., are all effective. And I think it's important to get vaccinated with whichever one you have available.
Yeah, and that's a great point. But the reality is we're going to need boosters down the track. Even the double shot is not going to be a silver bullet.
It's likely. So there's 2 reasons we would need to consider boosters. One would be from waning immune protection, right? That the antibody levels start to decrease over time. So far, the early evidence suggests that people maintain high levels of an antibody response at least 6 months to a year after. So we don't know at what point that's going to taper off and require a booster. But the second, of course, is to combat the incomplete protection posed against some of these newer variants, and the virus is mutating all of the time. And so if Delta continues to spread, if new variants arise, that may push us to need to think about boosters even sooner.
Peter, we always appreciate you making sense of all of this. Thanks so much.
Thanks for having me, Ben.